My name is Nordia Johnson, and I'm a member of the Health Committee of the Old Harbour Seventh-day Adventist Church.
Now that I understand that the Seventh-day Adventist Church has been doing this for a couple of years now. Why so?
Well, this is our 4th year doing the fair on this large scale, and this is a part of our community outreach to, just as members of the community, we reach out and provide services to the people who we serve. It's a part of our Christian mandate, so we don't just preach the word, but we also assist persons in, help the needy. And with the Seventh-day Adventist Church, you know that the health message is a very important pillar of our faith. And so, we decided to put on a health fair to help the members of the community. So we have a presentation going on now, as you can hear in the background, where he's talking about what we call now celebrations, what was called New Start, and New Start is an acronym. You have new N for nutrition, T for temperance, R for rest, and so on. So those are all things that are fundamental and important to persons and healthy living and a healthy lifestyle, which the Seventh-day Adventist Church is we stress on that a lot. Yes.
Based on the support that I'm seeing, the response has been great, and the community seems to be looking forward towards this. Is that the general feedback you are getting?
Yes, that is the general feedback we are getting. Usually we do have a large turnout. We don't usually get less than 300 persons on a yearly basis. That has remained so this year as well. Sometimes, it is so much that we don't end up seeing everyone, but we see a lot of persons. So this year it's not 12 o'clock as yet, and we have gone over 300 persons so far.
I understand that a lot of persons were here already, even before you opened the gates.
Yes, they're always here waiting on us. That is a culture here I find in Old Harbour. No matter how early we come here, somebody's waiting.
How it has been going though so far now? It's almost 12 o'clock now. And what are the kind of activities persons can able to have access to, or services they can have access to?
Okay, so we started off with 4 services today. So we had the dentist, we had the ophthalmologist who was here, and we're doing pap smears, and of course we have your regular doctor's checkup. You get your blood sugar, your blood pressure, the doctor checks you up, the school medicals, which is a critical thing at this time of year. So we're doing a lot of that. So we had those services available today. We have had to cut off at this point in time, cut off on the ophthalmologist and the dentist, but the doctor is still seeing, doctors rather, are still seeing persons, and the pap smear is still going.
I went inside and I saw a tent doctor's room.
Yes.
How do you manage to get so many doctors committed?
It's not an easy task, but I have to commend our health ministry's leader, who himself is a doctor, Dr. Christopher Barnes, and he does a lot. And when I say a lot of health fairs, so when he goes to a health fair to help out someone, when he's doing this health fair on behalf of the church, he asks other doctors and they will come in turn and offer their support. So it's really a camaraderie, I would say, within their field, that they help out each other at this fair. So that's how we're able to get 12, 13 doctors. Yes.
4 years now you have been doing this. What has been some of the most heartwarming messages that you have received from those persons who came and benefit from the services?
Well, some of the messages we've got from persons, they're saying, boy, they're really glad for this service. It helps them out a lot. And you see a mother come here, and you see she's here with 5 children. And if you are to imagine, if she was to go to a private doctor with those 5 children to do a medical, even if the doctor is charging $1,000, that's $5,000 we have saved her right there. And if she's to go to the dentist, one child to just get a regular cleaning at a dentist can be $7,000 to $9,000 and more if the child has, tooth problems. Right. So that's thousands of dollars we would have saved right there. So when persons tell us that you really help us out and we really appreciate it, you know, because it takes a lot to get this done, but it's what motivates us each and every year to keep doing it, and we always try to improve on what we would have done the year before. So the first year we did it, you know, it went down, but it was chaotic. And so we learned from that, and each and every year we aim to improve on what it is that we've done. And I think that we have improved on last year, this year, and so next year I'm sure it's going to be even bigger and better.
Talk me through next year and the other years to come. What are some of the things you already as a group would have now envisaged to say, we want to do this next year, or we want to achieve this in the next 2 years?
Yes, I think we'll be probably looking at some more services and just being able to assist more persons, because as it stands, even though we do a lot, at this early time of the day, we've still had to say, okay, for the dentist, we're not able to see any more persons. And, you know, you have had persons who have had to leave because of that, you know, so that's something that we would want to minimize or eliminate totally, that persons come, no matter how many persons, we are able to see them. The only thing that would restrict us is time, because, you know, the day will end, you have to stop at some point in time, but not because of an inability to be able to see them, you know. So that's something that we really would want to improve upon.
I know the Seventh-day Adventist Church is a very strong group. I suspect all the persons here who are volunteering are members of your organization.
Yes.
And you would have more than enough persons who are willing to come and volunteer their time. Is that the case?
Yeah, we do get volunteers. Yes, the volunteers, they're all members of the church here, which is just next door. And, you know, I really have to also say a big thanks once again to Portmore Community College, who have assisted us with the venue, because we are right next door, but we don't have this land space to facilitate this. And so we really have to say a big thank you to Portmore Community College, who, as a part of their community outreach, have assisted us with the venue at no cost. So, you know, they allow us to come over here, we're able to use their facilities and so on, as a part of their helping the community. So we want to thank them for that very much.
The volunteerism, just to touch back on that, but the volunteerism is very strong in your group, because you just recently did a surgery, and you're out here giving your time. I mean, what is it that would have caused you to override the pain and the inconvenience of your surgery to come and still serve?
It's God's work. It's God's work. When you come out here, you know, it's not the most comfortable feeling, as you say. I know that later or tomorrow I will feel it, but it's God's work. You come out and you help. That is what, as Christians, we have been charged to do. So you come out and you help. You think of others before you think of yourself, right? And God will provide. You know, I'm sure He sees that I am here now, and you know, no good deed goes unseen.
My name is Dr. Christopher Barnes. I am representing the Old Harbour Seventh-day Adventist Church. So all you see that is going on around here is the church effort, Old Harbour Seventh-day Adventist. We are just situated, we are neighbors, in fact, with the Portmore Community College. Now, Portmore Community College has they offered the venue to us that we could carry out this function free of cost. Right. So essentially they are partnership, right, with us. Now, as you can see, we have a lot of persons here, and persons are getting through for various services that we offer. We offer services such as the dentist, free, eye checks, free, pap smear, free, immunizations, free, doctor's visit, free. So everything that we offer here is free. We also are having a special for persons. One needy person will be offered a free CT scan, right? So we'll be searching around to look among the list of persons that came here, and one needy person will be getting a CT scan. Also, one needy person will be getting a free chest x-ray as well as a needy student. We offer them the expense for the book list and also for the uniform throughout the year. So this is pretty much our effort to outreach as a church, I mean, as Christians, we must all be doing something like that. We must be caring for the poor and help the needy. And this is the Old Harbour Seventh-day Adventist Churches. This is our version of contributing to the environment of the church.
Nadia gave us quite a mouthful, I must say. She did very well.
Yes.
But how do you manage to put this together? And so much so you have been able now to do this now for the 4th consecutive year. How did it all started and how you managed to really put it together?
All right. It takes a lot of time. It takes a lot of effort. It takes a lot of interaction because, as you can see, we have gotten about 12 doctors to work, right, for us, and they're all contributing their services free. The dentist free, as we said, the eye doctor is free. So everyone you see here, we are all volunteering, right? Now, it takes a lot of manpower. That much I can tell you, and a lot of planning from way back leading up to this event. It costs, right? Because the expense it's an expensive venture. But as we say, we value the community, we value persons as Christians. We value, right, what the Bible says in Matthew chapter 25, that we must tend to the sick, feed the poor, clothe the needy. So this is our effort. So when we look at it in that way, I'm not saying it's easy, but it's expedient.
Right.
All right.
What's the plan for going forward?
Going forward, we just want to get bigger. Because
how do you plan to make those steps to make it get
Christian's
bigger?
work never stops. Right? This is our work. And this is our part of the vineyard, whereby we minister unto God's people. We minister unto all the persons, whether it be the poor, the needy, the sick, even the imprisoned. We minister unto them because we seek to be like Christ. And that is the most important thing that I am asking, that's the most important message I want to put forth to you today.
Right.
And even so, I will ask you, both as persons who are aware that there is a God, who are Christian or a Christian nation, that we also do our part to help out mankind.